Good afternoon, everyone. This is Carolina Sale with the McSilver Institute, along with the Community Technical Assistance Center and Managed Care Technical Assistance Center of New York State, and I welcome you to today's webinar. Today's webinar is Using Art in Therapy, presented by Lauren Zeltzer, who's a licensed certified art therapist, among other things. The webinar today will cover sound practice for bringing the benefits of art to clients remotely and in person, and a focus will be given to the safe and ethical use of art and therapy by mental health professionals who are non-art therapists. But before we begin, I have a few important things to talk to you about regarding CTAC. The first one is, please don't forget to complete our CTAC annual survey. So we send this out every year, and I need you to know that we study the survey and the results so that we can really bring to you the best webinars and offerings that help fill your needs. So the deadline is Friday, October 23rd. Everybody has received an email about the survey, so we're just asking you to please complete it. If you've started it, you can go back to it and finish it. So the deadline is this Friday. Please complete it if you can. It should only take about 10 minutes. A few other things around sort of our housekeeping is that everybody is muted, but you can chat to us. So we will be chatting into the chat box on the right. If you can't see the chat box, you can hover below and pop it up. There will be resources, there will be some links that we can post in the chat box, or they will be in the slides that will be available within a few days on our website. There's also a quick survey at the end of this webinar. Please complete that if you can. It pops up on a different screen. It usually just takes like 30 seconds to complete. And that's also helpful for us because we are looking at all of our data with every presentation that we do to see if it's something we should continue to do and think about how effective it was. And lastly, thank you to all of you you are essential workers during this pandemic. I'm sorry that we haven't ended this pandemic. It's so unfortunate, but I know that you all are essential in the work that you're doing, and I just want to say thank you. So today, as I mentioned, using art in therapy is something that I think is amazing personally, and I know people have really benefited by this in therapy. And so I was looking for someone to present for you all to learn from. And I found out about Lauren. Lauren is a board-certified, licensed creative arts therapist who loves how art and creative expression can be used as a vehicle to give voice to the voiceless and marginalized, as well as the marginalized voices in our heads. She has graduate degrees from NYU, Steinhardt School of Art Therapy, and Columbia School of International Affairs. And her practice is deeply informed by her previous international economic development work, including serving in the Peace Corps. In addition to her private practice, Lauren was the art therapist at Weill Cornell Medicine, Midtown Center for Treatment and Research, an outpatient substance abuse clinic, where she collaborated with non-art therapist colleagues on sound ways to bring the benefits of art to more clients. I wanted to mention that during the webinar, in a few minutes, Lauren is going to take you through an experiential exercise. So we're asking you to please have a piece of paper or a note card or Post-it or something to write or draw on, as well as an implementation to draw or write on as well. So without further ado, I will pass it over to you, Lauren. And thanks again, everyone, for joining us today.
Thank you so much, Kara. And thank you, everyone, each and every one of you, for being here. I'm just so excited for this opportunity to share something that I'm so passionate about and which I hope will benefit you in your practice. So let's see, I'm going to try to move these slides. So today we will cover an overview of the therapeutic benefits of using art in therapy through a neurological lens, participate in an experiential exercise, increase providers' capacity to use art in therapy, and when to consult with a licensed art therapist, and discuss easily accessible materials and techniques. So I'm curious, how many of you currently use art therapy in your therapy or treatment sessions? Carrie, you're muted.
Oh, thank you. Sorry. So please chat into the right. How many of you are using art in your therapy? It doesn't mean you're an art therapist, but are you using art in your treatment sessions? So we have a couple I do. There's a few people. Not send I use them. Somebody just said not. Oh, everybody's coming in quickly. Thank you so much. This is great.
Yeah, it's interesting.
Yeah, it's interesting.
Yes, mindful coloring sometimes, frequently. Yes, it seems like most people are using art in their therapy or treatment sessions. Great.
Great. Okay. Cool. All right. So, I'd like to begin with clarifying what we mean by art therapy and using art in therapy. So in New York State, art therapy is a licensed profession. The term art therapy can only be used by licensed art therapists, and the art product and process of making art are central to our practice. In addition to prerequisite studio art training, licensed art therapists have graduate training in the creative process, art therapy assessment and psychodiagnostics, symbolism and metaphor, and supervised clinical art therapy experience. Art in therapy, as I use it, is the sensitive, safe use of art making by mental health professionals, non-art therapists, to complement one's practice. And although art therapy training can't be replicated in a workshop or a seminar or a semester, using art in therapy can be ethically and effectively used by other mental health professionals, which is the focus of my talk today. Let's see. Just getting. Okay. Any of us who work in the field of mental health work with clients and patients feeling anxious, disconnected from others, and limited and locked into a life not as fulfilling as they want. And coping with life during the pandemic has magnified these challenges for many people. There's the added layer of stress around virtual mental health support and risks and extra precautionary measures if meeting in person. I believe this is an ideal time to integrate art into your practice as a tool to help clients better accept and cope with these challenges. What are the benefits of using art in therapy? I'll start with the 3 R's. Art regulates mood. It's fun, relaxing, and brings our focus to the present moment and provides a break from worrying about the past or future. Art supports reimagining. It can help us reconnect with our untapped creativity, which is a powerful way to help people break out of a sense of limitation. It can renew, recharge, and guide us. We begin to feel how alive we really are. And that is the beginning of getting unstuck. Art reduces isolation. Creating art in therapy collectively or within an individual therapeutic relationship shifts our awareness to our human interconnection and an experience of feeling deeply seen and heard and rising above differences. And this provides the foundation for supporting social equality amongst clients, which I'll speak more about later on. Art is cost-effective. Powerful benefits result from using inexpensive, simple materials, either from home or even just office supplies, copy paper, colored pencils, legal pads on our laps as a surface for drawing on, and manila folders to store the work. And through my own observations, I see that using art with clients enhances their investment and engagement in treatment, which helps with retention. Art is also well adapted to pandemic conditions. The benefits of using art translate well to online sessions. Creating art in virtual sessions gives clients a layer of privacy. They're able to create without others seeing their work unless they choose to show it. And I find that this frees people up to create more readily. Art also provides a break from virtual talking sessions and gives clients a sense of control in the midst of restrictions and uncertainty during the pandemic. And finally, art is accessible to all. When I talk about using art, it's not about whether you can draw or not. Artistic ability is not necessary. Creativity is inherent in everyone's consciousness, even if it seems to come or go and it's blocked. Art in therapy and art therapy work equally well, whether you're good at art or not. And the examples I will be sharing today are also appropriate for clients of all ages, children, teens, and adults. I'd like to start with an experiential check-in exercise to give you an idea of what art and therapy feels like in a virtual session. You can also adapt and use this exercise with your own clients. So as Kara brought up before, you'll need markers, crayons, colored pencils. If you don't have these, a pencil or a pen is fine, and a sheet of blank paper or an index card. So I'd like to check in and invite each of you for the next 5 minutes or so to create an image to express how you're feeling today. Your work is for your own eyes, and you can't do this wrong, so I invite you to have fun with it. Some ideas for starting are you can just choose a color and make a line or shape. You can trace your hand and fill it in, make a scribble and identify an image and embellish it, or close your eyes while you draw, or use your non-dominant hand. When you hear the chime, let's take 5 minutes in silence to create an image, and I will keep track of the time. In the next minute before we return to group, I'd like to ask you each to take a moment and notice any thoughts or feelings that came up for you doing your work or looking at your work. And if you like, give your work a title and date it 10/2020. Welcome back, everybody. So I'm curious, I'm wondering, where did your art take you? And would you have gone there just by talking? Can you imagine, did it feel different doing the art? Would it have felt differently to you if you were alone where you were just doing the art as opposed to even being in a virtual group? And I'd love to hear in the chat any titles, feelings, thoughts, insights, or challenges that came up.
A Galaxy of Thoughts is somebody's title. Round and Round is somebody's title. A lot of people seem to say it was relaxing, that somebody said that I haven't actually drawn or doodled in a while, so it was relaxing.
Stressed out, okay. Yeah, so interesting. Thank you so much. These are great. Art, not my thing. I love that. Okay, thank you for your honesty. Okay, so Everywhere at Once, the name of my creation. Nice release. Okay, so there's a range. Judgment towards my art. Yep, I hear you on that. I've been there. Yeah. Okay, I love art. It's very relaxing. Okay, I got lost. At peace. Super helpful. Embarrassment about my drawing abilities. Okay. Wow, beautiful. Just thank you, everybody. Just even this, for trying it and sharing in the chat. Calm chaos. So I think we have another chat. Did you experience, right, relaxation, curiosity about your work, connection, difficulty with your work? Okay. All right. So thank you again, everybody, for your honesty and for even just trying this out. I did see some comments. It wasn't easy for everybody. I know art's not for everybody, and sometimes challenges come up for people around the art, and that's okay. It's not uncommon for resistance or negative feelings to come up around doing the art. And I think the challenges themselves can lead to valuable discussion and insights, and it's important to welcome them with respect, curiosity, compassion. I often ask clients, do you have any ideas what's underneath the challenge for you? Does this challenge feel familiar? Does it show up in other places for you? So that alone can sometimes be valuable. And I also always like to give people choice to sit this out and just observe. It's important to let people have their no around art, even if the idea of creating art can feel, threatening to clients. And sometimes it's a process to build trust to try it. Okay, so I noticed too that people wrote in comments that they had experienced certain shifts. It was relaxing, so I wanted to. This would be my lead-in to talk about what's happening when this shift occurs when using art. Art therapy is historically rooted in Freud's psychiatric movement and the unconscious symbolic dream imagery and Jung's universal unconscious and symbolism, but we now know that it's also a biological intervention. Advances in neuroscience support that brain functions such as self-regulation, relaxation, attunement, memory, and visual processing are activated when people make art. Art and meditation are associated with similar self-regulating brainwave patterns. Both sides of the brain are activated when doing art, and through this bilateral stimulation, breathing slows, blood pressure slows, the body becomes more relaxed. The creative process causes specific areas of the brain to release endorphins and other neurotransmitters that relieve pain and create an experience of expansion, connection, and relaxation. One of the most dramatic examples of the self-regulating power of art occurred with an 11-year-old boy I worked with in an inpatient psychiatric hospital whose increasing episodes of explosive anger culminated in his kicking his pregnant stepmother in her abdomen, which resulted in his hospitalization. I was scheduled for an art therapy session with him. We had already worked together for a week. When I arrived on the unit, it seemed like they were doing construction on the building. The walls were vibrating with the booming sound of heavy equipment. The head nurse told me my client was not available for art therapy as he was in a rage and was in the padded quiet room where they were waiting for him to calm down enough to increase his medication. Then I realized in disbelief the construction noise and wall vibration was from my client repeatedly hurling himself against the padded wall. I took a chance and knocked on the door of the padded room and said, "It's Lauren, do you want to come out and draw?" I was surprised as anyone when I heard a small okay from him. The nurse opened the door and he silently followed me into the therapy room with an aide accompanying us, where he quietly began drawing with graphite pencil and paper. Using color and other materials were too stimulating for him. After a few moments, a shift occurred and he began to cry while still drawing. Towards the end of the session, he verbalized around the violent themes in his image and anger he was feeling about his parents wanting him to go into residential treatment. Again, this is a dramatic example of how art can shift mood, in this case, to the degree of avoiding increased medication. But a second example that I experience more often in my practice and that can be more easily replicated is with a family systems group I facilitated at our clinic for clients experiencing family ruptures due to their substance use, including court-mandated parents at risk of losing their children. You can imagine the intensity of emotions in this group. I always provided art materials just for fun and relaxation, I called it, which clients used throughout the group to support self-regulation as they verbalized. I will share these materials with you shortly. And when our group became virtual in March due to the pandemic, clients used materials from home with the same results. Mental health counseling and social worker interns who assisted me in the group regularly remarked how calm and focused the group was and how quickly and deeply clients engaged despite the difficult emotional content. I believe the self-regulating quality of the art materials played an important role in this. And paradoxically, I find that using art in sessions seems to relax clients when they're anxious and engage clients when they're tired. One of the most exciting aspects of art in therapy is the unexpected recognitions that come from artwork unintended by the artist, which lead to enhanced insight, learning, and growth. As infants, we thought in images before we had words, recognizing our caregiver before we could say mama or papa. We still think in images with thoughts and feelings woven in. Imagery is also an important component in our dreams and our unconscious, but the meaning and richness of our experiences can get lost when translating them into words. We are also more adept at manipulating our words, saying what we want to say and holding back from what we don't want to say. Art bypasses our verbal defenses and can help us reconnect with ourselves and guide us. An example of this is one of my clients who was on leave from his CFO position because his alcohol was affecting his work. The client had not done any artwork since elementary school, but in response to our group check-in, drew himself as a stick figure crossing a bridge towards his bright future. The client then noticed his stick figure, despite his limited art skills, was drawn in such a way that it could be viewed as either going forwards and backwards on the bridge. Upon further reflection, the client acknowledged this accurately expressed his ambivalence about giving up drinking and moving forward in his recovery, something that he had been denying. This enhanced insight led to addressing his feelings more honestly in treatment and getting unstuck. Research now supports that compared to conscious verbal awareness, visual information also possesses a fast track to the amygdala and limbic area of the brain, where much of our pre-verbal thinking is stored, as well as implicit memories from stressful and traumatic events. Art is an efficient way to access this, particularly when traumatic memories are blocked or are too painful for words. And certain art directives and materials can more easily bring up this emotionally evocative material, which can be dysregulating for clients, and which I will be discussing more about shortly. But art therapists are well trained in safely using art with clients to process traumatic memories. Art therapists have long known that watching clients create art or creating art alongside a client is a very connecting experience for both the therapist and the client. Without any words being exchanged, there is enhanced attunement. In the 1990s, a team of Italian researchers discovered mirror neurons in the brains of monkeys that fired both when a monkey does an action and when seeing another monkey's action. And we now know that mirror neurons in humans imitate the brains of those we are with in order to better understand them. Without any conscious effort, our mirror neurons create a brain-to-brain connection to put ourselves in someone else's shoes, understand their actions, feel their emotions, and assume their intentions. And as mirror neurons fire in response to anticipated and implied movement, it is thought that using art materials in therapy, seeing others make art, and making art alongside others stimulates this mirror neuron system and provides a foundation for empathy and attachment and feeling seen and heard. I facilitated a living sober group at our clinic on Friday afternoons that brought together people from all walks of life across age, race, culture, education, socioeconomics, types of addiction, and that went virtual in March due to restrictions from the pandemic. Beginning this group with a check-in, similar to the experiential we did earlier, created a palpable feeling of camaraderie while clients were drawing. Often group members from different walks of life with conscious awareness of only their own drawing created similar images and expressed similar themes, as if mirror neurons were firing between clients as they drew, even through a computer screen. I believe using art results in leveling the playing field in groups, with clients finding commonality and unexpected connections that lead to rising above differences and rich, engaged discussion. And I feel excited about the larger potential for using art as an attunement power tool to support social equality amongst clients. Now I'd like to give you some specific guidelines and strategies for using art in therapy in your practice. So number one is, I treat clients' artwork with respect and care. I treat the artwork like a client's precious newborn, always asking permission before holding it. I handle it respectfully. I don't place it on the floor. And I give the same respect for clients' choice to share or not share their artwork or to not engage with the materials. Clients' artwork is treated as a medical record by art therapists. We are required to keep it for 7 years after a client's discharge. I at least suggest clinicians be mindful of the sensitive private nature of any client's artwork. Working virtually provides an easy solution to this, as the artwork stays with the client. This is a big benefit to online work, as storage of artwork in an office can become problematic. I suggest to clients they date and store their work in a folder at home as a visual record of their progress in treatment. If you're working with clients in person, I also recommend storing the work in a folder or suggest that the client bring the work home. And because of the sensitive, private nature of a client's artwork, even if it does not appear as such, I always avoid displaying any artwork in the office, even at the request of a client. I have done bulletin board work before, where I allow all clients can put their work on a bulletin board, but that would require a whole separate webinar. That's a complexity in and of itself. I suggest to use only dry, non-toxic media that conforms to the American Society for Testing and Materials Code. It's the ASTMD 4236. So this code should be printed on any package of art materials that you use or recommend to clients and indicates that it meets all safety standards and is not a health hazard. Art materials correspond to different emotional and cognitive brain functions. It's something that our art therapists are trained a lot in. But the materials are from most resistive, like a pencil, which is likely to promote cognitive responding, to most fluid and likely to promote affective processing. And fluid media, such as wet clay and paint, can elicit triggering emotional or traumatic content that can be dysregulating for some clients. And it's sometimes really difficult to know ahead of time who's going to be triggered. So for that reason, in the context of this webinar, I suggest only using dry media with clients: pencils, crayons, markers, oil pastels, and magazine collage. And I'll be listing some of these materials shortly. How do we talk about the art when it shows up? Clients are the experts on their own art is a good rule of thumb. Use open-ended, client-centered questions. I ask, tell me about your work. Emphasize listening to the artist and eliciting a meaningful story without providing your own commentary or association. There's inherent value in the work, regardless of its appearance. Avoid praise or criticism, such as, that's beautiful, I love your drawing, or you're a good artist. Make only neutral observations, focusing on shape, size, focal point, colors. And try the activity yourself, and try to imagine the range of responses clients might have. Having your own experience with the check-in earlier will be helpful for those of you who plan to try it with your clients. And finally, those of you who are working with clients in person, there are precautions during COVID around using art materials. Like hand washing, art materials must be cleaned in between use from one client to the next. Consumable or single-use art materials is a great way to lower risk of transmission of germs. And I'll be giving suggestions for these in a moment. And the American Art Therapy Association's website is a great resource for more information on this as well. And they're listed in the resource slide coming up. So I've identified the following materials and directives that I find are effective and easy to use, both virtually and in person, for clients of all ages, and these are designed to be integrated with verbal sessions to support self-regulation, enhanced insight, and attunement. I've already introduced check-ins as a springboard for discussion. I suggest limiting the free drawing time in your check-in to 5 to 10 minutes as we did today. And you can use the same options I used in the experiential. Choose a color, make a line or shape, trace your hand, scribble and identify an image, close your eyes, or use your non-dominant hand. I find clients sometimes feel less intimidated using smaller paper or contained shapes for a check-in. Index cards are great. Or clients can trace a circle in the middle of the paper and draw within that. And I've also printed out and had clients print out human templates for check-ins, which clients like to embellish or draw what their pain or emotions look like and where they're located in their body. I've also discussed the importance of folders for storing artwork, which can later be reviewed as a visual record of clients' progress. The folder itself can be a metaphor for protection, containment, and a self-symbol that clients can personalize by writing their names on and drawing or making collages on. When working in person with clients who are homeless, folders are particularly meaningful as a consistent, stable place to keep what has meaning for them. Both for virtual and in-person use, I recommend manila office folders or poster board folded in half and taped up the sides. Poster board is great because it holds larger artwork and has more surface area to draw or collage on. I get a lot of therapeutic mileage from using simple art materials for self-regulation. I recommend these for clients to use while verbalizing in verbal sessions, or keep these on hand in my office. I use these in groups, like the Family Systems group I discussed earlier, individual sessions, and even during intakes when I see that prospective clients are anxious. And especially with children, using these materials alongside them or with them in person or virtually enhances relaxation in the therapeutic alliance. I keep packages of colored chenille sticks or pipe cleaners that clients can braid, weave, or make figures from as they're talking. I also use Crayola Model Magic, which is an odorless, dry textured clay that feels like dried marshmallow. I think for just about $20 for a box of 75 packets of red, blue, yellow, and white, which is much safer than wet clay with less risk of eliciting emotional material. The teens I work with in our clinic would stop in my office to ask for a packet to use as a stress ball in their verbal groups, where they enjoy mixing colors from 2 packets, which gave me the idea to offer it in all my groups and suggest it to clients in virtual groups as well. And I've been surprised at how even adults who don't usually allow themselves to do art or play like to engage with the model magic, all while verbalizing in sessions. Finally, I like to use coloring book pages to color in. I used to be a snob about these, but boy, I was proved wrong. I find that coloring book pages and particularly pre-printed mandalas from the internet, which are universally appealing and soothing, that I don't underestimate the power of these materials to also elicit new insights. Before end of session, I ask if clients would like to share a title or insight from their coloring or sculpture, which often results in insightful comments related to what was discussed in the session. The final material I recommend is using magazines to collage with. Before COVID, I kept a stack of magazines in my office for groups and individual sessions supplied by my chiropractor and donations from clients. And magazines are great for clients, especially teens and adults who are self-conscious about doing art, because the words and images come to them as they turn the pages. And there is inherent emotional safety in magazine collage because of the regulating process of making order from chaos, organizing cut or torn pieces into order and new meaning, which is a wonderful metaphor for how we heal in our own lives. You can begin a virtual group with each client selecting a word or image from their magazine at home, or even a stack of junk mail to express how they are feeling. Or clients can collage on their art folders to make a vision board or self-portrait to share with the group. Be mindful of risks for harm and self-harm using scissors. Tearing paper is a good alternative with glue sticks or tape. And again, I ask clients to title and date their collage and ask, tell me about your collage. And a final suggestion is to use art in therapy as an opportunity for watching a client in action. Observable behavior around the art can be a springboard for discussion. How does the client engage with the materials or handle the materials? Is she throwing the artwork out? Is he hoarding materials? Are there any physical limitations? Shaky hands? All of these can be a valuable springboard for discussion. What to do when challenges occur? Know that art therapists are your allies. I'm really hoping that the webinar today will be the foundation for bridges built between professions. We're available for consultations and adjunct sessions. When might this be appropriate? When artwork becomes central to a client's case due to either the large volume or confusing, disturbing, repetitive content. And sometimes unconscious material can come up and you and your client are confused about what you're looking at. or when a client struggles with verbalizing or is too dysregulated to verbalize around a traumatic event, collaborating with an art therapist can be helpful. When clients or groups seem stuck, an individually tailored art directive can ignite new movement. Finally, art therapists can integrate art around a special event, issue, or collective trauma. The American Art Therapy Association is a great resource for locating a licensed art therapist in your location. And again, their website is listed in the resources. Finally, I'd like to leave you with suggestions for next steps if this is new to you. I know that I presented a lot of material today, but just know that increased awareness alone of what is art therapy and the therapeutic benefits of using art in therapy and knowing there are guidelines for its safe, sensitive use with clients is an important step towards enlarging your practice and your provider toolkit. Take some time to explore using the suggested art materials yourself to gain comfort and confidence before introducing them to clients, or to use them for your own self-care. You can use them in a playful way, for relaxation, or as response art following a stressful situation or a client session. Giving your work a title and revisiting it a day or a week later often brings continued clarity and insights. Finally, small actions are powerful. Start small with clients, using 1 or 2 guidelines or materials that resonate with you from this presentation, and build on that. I have some resources for continued learning. I think I talked about the American Art Therapy Association, the Haas, Cohen, and Finley book, which is great for learning more about the neuroscience of using art. And Harriet Wadeson is a pioneer in the field of art therapy. This book is well written with clear explanations. And then finally, the annual Expressive Therapy Summit, which this year is online. It's usually in Midtown Manhattan, but I've gone to this many times, and it's a great resource for providers. I think there's going to be 125 sessions over 12 days this year. So I think, thank you for your time and interest today. I'm inspired imagining the collective ripple effect of using more art in therapy, and I'm open to answer any questions.
Thank you. Thank you. I think there's some feedback when both you and I are talking. So Zoom is going to be muting you when I talk, and she'll mute me when I'm not. Okay. So thank you for that. I think that was really helpful for people to understand the context of art and therapy and the neurobiology, the mirror neurons, as well as strategies. I think it was super helpful for me to hear about some of those, and I hope everybody else here enjoyed that. So let's get into some Q&A since we've got some time. It's fantastic. The first question is, can art therapy be used among the variety of mental illnesses?
Can I see that written, Karen, or am I just listening to what you're saying?
You're just listening. We have it on we collect all the questions. We have them on a Google Doc.
Okay.
Maybe the question is there any kind of mental health challenge where you wouldn't use art therapy? How about that?
Well, that's a good question. My rule is always safety first. So if someone appears that it bothers them, they get more dysregulated with the materials or even the idea of using the materials, then yes. So I would say, I think that's more a question about the individual than about a mental issue. So I've dealt with such a range of clients over the years, sometimes extremely dysregulated, psychotic clients who the art works so beautifully with them, and then people who appear to be so highly functioning who want nothing to do with it. So I think it's more just knowing your client, and I would say stick with the dry media, because wet media you can go south really fast, and so I would suggest staying away from the wet clay and the wet paint across the board. Stay with dry media, and then tune in to your client as an individual.
Thank you so much. I think that's incredibly important for everyone to hear, that it's not about the particular mental health challenge. It's really about the skill and holding the space for safety. The second question is, do you worry about negative images in magazines? So if somebody were to pick negative images, would that concern you, or do you worry about having a magazine that doesn't have negative images? Any thoughts there?
That's such a great question. So this used to come up because in the substance abuse clinic, our substance abuse clinic, people would complain about magazines having images of alcohol. And we went back and forth on this for quite a while. Yeah, that's a good question. I tend to lean toward bring it on, and then you deal with it. Like if there's a negative image in a magazine that a client wants to use, it's the internal negative image that's coming out. And so what's great about once it comes out into an image, it's externalized and it's contained in an image, which already makes it safer and more able to work with. Then you can I've had clients do very negative imagery around an assault or a rape or an accident, a hospitalization, and then the work is containing it. They have a special folder for it that they tape up, and they work on containing it, or they can do writing around it. So once that image is out, there's so much work you can do around processing and secure remembrance and getting support and supporting that client around it. I hope that was helpful.
Yes, fantastic. Thank you. I hope that's helpful too. Here's another question. How do you engage clients who cannot focus?
Oh, that's interesting. Well, I find that the art materials help them focus, and or the right art material. So, and that sort of speaks to that comment that I made earlier around art materials, that when people are anxious, the self-regulating materials helps them feel calmer, and then when they're kind of sleepy, it sort of wakes them up and helps engage them. So maybe it's the directive or the material that they're being asked to use, but I find that clients like using the model magic as a stress ball during groups actually help them focus, or being able to manipulate a pipe cleaner as they're talking really helps them focus on the group, or coloring in a mandala during group, or while they're verbalizing really helps with the focus. I'm not sure if there's another nuance to your situation, and if you want to ask me a follow-up question to that.
Okay, great. So feel free to write a follow-up question if you'd like. The next question is, do you offer positive reinforcement while people are creating their artwork?
Good job, or oh man, I wonder, positive reinforcement. So how I brought it up in the context of this webinar would be clients would be verbalizing in group while they're doing the artwork. So the focus wouldn't be on their artwork, it would be on the group. And then clients have a choice to bring in their insights around the artwork if they choose. And it's a whole different ball game. When I work one-on-one with clients, we can work up to an hour in silence, but I'm trained, our therapists are trained in working in silence. And in that situation, no, I think it has inherent value, just what's happening. And I'm more inclined to ask, how is this for you? How is this feeling for you? Rather than, oh, it's great that you're doing this. It's, how is this feeling? What are you noticing? What's coming up for you as you're doing this? But that said, there's a lot of feeling a lot of compassion for people, and while they're doing it, so it's more like a nonverbal kind of a reassurance, I suppose. I'm not sure if I answered that.
I think just checking in about my feedback. Can you hear me? Okay.
You sound fine.
Okay, great. So one question, I think this is maybe helpful for people here, is how should a note be written about a person's art? So if I'm spending a session with someone around art, how should I write that note? Are there things that I should or should not write?
Yeah, that's a great question, because it's right. It's observable behavior, I guess, that you're writing about. So it's interesting. I would say if you're not an art therapist, some issues can come up that if you're spending a whole session just sitting there in silence while someone is doing art, you're in territory. I kind of liken it to it's like going to Paris and you don't speak French fluently. I can get a lot out of Paris knowing a little bit of French. It's not that I shouldn't go, but to go to Paris and maybe work and not be fluent, working in the nonverbal realm, sitting there with a client for an hour while they're doing artwork, that can get complicated. That sort of goes into the part of the training of being an art therapist, is those long stretches of nonverbal time, and you learn to feel things and see things that are invisible to, without a lot of training, you almost don't, sometimes you miss them, sometimes you don't know what you're seeing, you can't feel the shift when a client is starting to go south, drawing or having an emotional shift inside. So for that reason, I would say not to be getting yourselves into situations where it's long stretches of silence while you're sitting there as a client draws, that you're weaving it into the work you already know well, which is your verbal work. You're weaving it into what you know, and using it as an enhancement to that. And then the artwork would be treated as something that's going to add to that or enhance that.
Thank you. There's so many great questions coming in. Somebody was saying back to the attention thing I just want to make this comment. It was great that they found working with kids who had ADHD or ADD that it was hard to keep them engaged, that using their body and the art would have been really helpful, maybe like throwing paint at the canvas or, on a wall or something like that. So I just wanted to throw that out there. That sounds like that could be really helpful. Somebody was saying, with the substance abuse and mental health patients, what do you suggest as a beginning art project? Patients have used collages to express themselves and self-portraits. They've even used pictures to describe where they are at now and where they want to be in 5 years. However, there is so much trauma that I would like to engage them with art. What do you suggest?
Yeah, that's a great question. So I find that, and there are books with directives on art therapy with substance abuse, but I find really one of the most powerful and healing ways to use art with clients in substance abuse is actually around that mirror neuron piece that I talked about and the self-regulation piece. That, there's so much, I see so much clients self-medicating for trauma, and it's around attachment ruptures, and very much around not feeling seen and heard, around there's a lot of shame, and just it's so healing to be in a group and to be able to have almost a corrective experience and a corrective familial experience of that's generated by the intimacy that's generated when you're creating art in a group. That in of itself can be probably one of the most healing things, even more healing than a specific directive.
Thank you. Somebody's asking on that note about some of your recommended books.
Oh, to the group. I'm sorry. I'm seeing some of these questions too, Karen.
Okay.
Question I want to answer, but I'm letting you. You're looking. You see more of them than I do. But there's a question about books. I don't know.
Books, I think a few people are asking about books. Any kind of recommended books or other resources?
Oh, besides the ones that I listed in the resources. I could provide more, but I'm sort of blanking right now on the specific titles. But the American Art Therapy Association is a great resource. I would start there, and I would also look at the Expressive Therapies Summit. I think those two between those two, they would take you far.
Okay. One more question. I think we have time for one more. What about using art through telehealth? What would you recommend? A lot of people are still online with clients. What would you recommend about specifically using art with clients during telehealth sessions?
Well, I specifically geared everything in my presentation to telehealth. You can use it in person and also telehealth, and I've sort of tested everything, and it. I almost think the art therapy works better in telehealth. I've been so pleasantly surprised. Clients just surprise me all the time, even with what they bring for their materials, what they're digging up from home. That's so creative and inventive. I remember a client bringing like an old Lego set and making this incredible Lego sculpture and having this big story around it that just brought the whole group together. And I couldn't have even made that up. So, and again, I said just the fact that we have this kind of private space where you can do it in private and then choose to show your work seems to free people up. And people seem to also, they're taking more ownership. People that don't have art materials at home, my clients take a lot of pride in, I went to CVS and bought myself a pack of colored pencils. I've never done that before. And so it gives people ownership over wanting to do and bring this into their life and use it for self-care beyond the clinic, which I think is a real benefit. And people continue using it at home in between sessions.
Great, thank you so much. So these slides will be available in a few days I think today is Tuesday, by Thursday with the slides. Actually, a lot of people are asking for copies of your slides. So if you have further questions, you can contact Lauren Zeltzer. Here's her email. And she also has a website. Okay, and if you have questions for CTAC, please contact us at ctac.info@nyu.edu. Again, please, if you can fill out that brief survey at the end. I think this is such a great webinar. I so appreciate, Lauren, your expertise and sharing it with us and everything that you know about using art and therapy. So hopefully you all have been thinking a little differently about some of the work that you do with clients and how to use art and therapy, or it sounds like a lot of you are doing and maybe got some ideas around that. Upcoming events, just really quickly. Conversations with Dr. Tony, what can organizations do to improve anti-racist and anti-oppressive practices, this Thursday with Dr. Linda LaSalle-Bryant. If you don't know Dr. LaSalle-Bryant, please join this webinar. And if you do know her, join this one. She's fantastic. This is going to be a fantastic offering. It's only 45 minutes long, and it's a quick conversation about what you can do in your organization to improve anti-racist and anti-oppressive practice. And then we have the impact of technology and social media on youth mental health, an incredibly important offering on Monday, November 9th from 1 to 2. So hope you can join us for those things. And I just want to see if, Lauren, you have any last thoughts or comments.
Just thank you, everybody. Just thank you all for being here today. And yeah, I really appreciate this opportunity.
Well, thank you. And everyone, that ends our time today. I hope you have a great day and great week, and we'll see you soon. Take care, everyone. Bye-bye.